All right, thanks so much, Heidi. In this week's Terri Tells You, we were sitting down with Dr. Craig Barker, who is a family practice physician with UMC Health Center Services. Excuse me, Dr. Barker. Let's talk about the coronavirus. Let's break down what's correct, what's not correct, and what the CDC advises.
It has been a very interesting week.
Yes,
and
it has.
CDC is changing things as things develop. So we can know something this morning that may be changed by this afternoon. And as we've seen, this has just been a very difficult thing to get a good handle on for every country involved. It's been nice that we've been a little bit later in that than some of the others, so we've been able to get ready a little bit better and learn from China and Iran and South Korea and Italy. So we think we're a little bit better spot than some of those because we've been able to pay attention. And of course in West Texas we seem to be getting it a little bit later than some of the other people, so we think we're still ready. That's good.
We're still ready. Okay, so let's talk about focusing on steps to prevent the illness. What are some steps to prevent the illness?
And one of those terms people have heard a ton in the last few days is social distancing, which is completely against what we do in West Texas.
Right.
In West Texas, we want to shake a hand, high five, give a hug, but in the last few days, we really have been talking about stopping doing that. Try to stay that 6 feet apart from someone else, to find a different way to greet. And we don't have to grab their hand as our grandfather all told us that we should. We just need to do a better job of that. If we do come in contact with anybody, or if we cough, we need to be doing our hand washing for 20 seconds with soap every time we cough, every time we touch somebody else. That means a lot more hand washing than some people are typically used to, unless they're in healthcare. If they don't have soap available, they do want to use some of that alcohol-based hand washing or sanitizer about 60% or higher. Kind of important. And then other than that, we really just want to be ready for our body with rest. Keep ourselves rested, get good sleep, get good nutrition, get good hydration. Be ready for your immune system that may need to be fired in the next few days to weeks. That if you're not resting, if you're burning the candle at both ends and you're not ready, then your immune system is going to have some trouble getting a hold of this virus.
For sure. Let's talk about who is the most at risk with this.
Those with any other condition, our asthmatics, our elderly, the diabetics, the ones with congestive heart failure, people who already have some illnesses that are making them less than ready to fight anything new. So those are the ones that we focus on. We know that there's very few people, if anyone in our area, who has seen this virus and is ready for it. So it's going to pass from person to person. That's okay, because most of us, the vast majority, are going to be just fine. We're going to get sick, we're going to feel fever, we're going to get achy, we're going to cough, and we're going to get over it. Those others are the ones that we really worry about.
Right, those are the ones that are so concerning. Soap and water. We've talked about it. Soap and water. That is the biggest key to keeping yourself safe and unsick and spreading germs. Wash your hands. It seems like such a common sense type thing.
Exactly. It shouldn't be that difficult of a concept.
No.
But we just get lazy.
Yeah,
we get to where we're just not in the mood, or we think I can kill what they have, we're good.
Right.
But when it really comes down to it, this one is going to bother people, and we don't want to be the ones who got it. We also don't want to be the ones who give it to someone else.
Exactly. That's the sad part. Now, if you get symptoms, you said y'all had a meeting at UMC today. So let's talk a little bit about what y'all discussed.
We've been having many meetings, and I'm now the corporate medical director for UMC Physicians, which is different for me, but gets us into more of these meetings, which has been very interesting on how are we going to be ready and most prepared to serve the community. I know the other hospital systems are likely doing the same thing. We are working hard to centralize that treatment as much as possible. Right now, if you go into your doctor's office, there is a chance you have now infected the waiting room and the staff and your doctor, and depending on the CDC guidelines and how much contact you had, they may be quarantined for a while and not be able to care for anyone for a few days after that. So we're hoping that you will call your doctor's office before you go in. Talk to them, talk to their nurse on the phone. They may transition you to somewhere else. We've also got our telemedicine app up and running. It's called My Team Care or My Team Care Now. That one's been up for a while, but this is one of the better applications for telemedicine, because you can do that without touching anyone from the comfort of your home, consult with a provider, and get some idea on what should I be doing and do I really have a risk or not.
All right, well, we're going to take a pause button there. We're going to come back after the break and kind of finish this discussion. We'll be right back.